So, what is dementia? Well, dementia is the term that we use when there's a progressive decline over time in an individual's cognitive abilities, by which I'm talking about things like memory, thinking, and the ability to process information, problem solving, language. It's all kinds of factors involved in cognition. I'll talk a little bit more about that as we progress along through these slides. So the changes we see in dementia are over and above the changes that we sometimes see in normal aging. And when we diagnose dementia, it's because those changes have started to affect the person's ability to function independently. So there are a number of different conditions that cause dementia, and we'll see a bit more about those later as well. And there's no cure for dementia. We do have some disease-modifying agents that we can prescribe to help with the symptoms of dementia, but at present there's no cure. And when we're thinking about dementia and trying to understand dementia, I think it helps to hold on to the idea that the human brain is an extraordinarily complex organ. So it contains around 86 billion nerve cells or neurons. And I think this is an amazing image. It's a photomicrograph of a neuron that's been grown in a lab, and I love it. And I showed it to my 12-year-old son, and he said, "That's disgusting, Mum, it looks like a sneeze." So that kind of spoiled that for me. But we have these 86 billion neurons and about the same number of support cells in the brain called glial cells, and their job is to help the neurons function effectively. And the neurons communicate with each other using electrical impulses, and it's estimated that each neuron is connected to, on average, 7,000 other neurons in the brain. So this is a huge number. If you think we've got 86 billion neurons, each with an average of 7,000 connections, that amounts to around 100 trillion connections, which is a really silly number. It's just impossible to really get your head around that number. A recent BBC 4 documentary suggested that that's about as many ants as there are on the planet. So that's a huge number. So you start to get a feel for the complexity of the brain and why sometimes it's really not easy for us to figure out what's going on when something's gone wrong. So these billions of neurons work together to process the vast array of sensory information that we're continually bombarded with throughout our lives, process that information, and then control our thoughts, our feelings, and our behavior. And it's worth bearing in mind that the brain also has an amazing blood supply. So this is a cerebral angiogram showing the bigger blood vessels in the brain. Although the brain only accounts for about 2% of body weight, it receives 15 to 20% of the body's blood supply via a very complicated system of blood vessels. And this image is a microscopic, it's another amazing image, and it's showing how the blood is supplied to the cerebral cortex, which is the very outermost layer of the brain. So you can see how the blood vessels dive down into the cortex and then branch into this beautiful network of tiny, tiny blood vessels. And I think a lot of us are used to thinking about the concept of heart disease as a disease of the blood vessels of the heart. And we need to always hold on to the fact that the very same disease processes that can affect the heart can also affect these blood vessels in the brain. So, dementia results from an accumulation of damage to those nerve cells, the neurons, over time. And it's caused by a variety of different conditions, and the course and symptoms of the dementia vary depending upon the location and the extent of the damage to the brain. So when we think about the types of dementia, about 62% of cases of dementia in the UK are attributed to Alzheimer's disease. And this is a condition where we get very prominent short-term memory difficulties early on. There's often a very insidious, very gradual progression over very many years. And this is a group of people who we can prescribe memory medication to. Then around 17% of people have what's called vascular dementia. So thinking back to those two slides that showed the blood vessels, we're thinking about different types of damage to the blood supply. And it could be damage to the bigger blood vessels, causing symptoms of a stroke, or it could be damage to those absolutely tiny blood vessels we saw in that beautiful photograph. And if you had an accumulation of damage to those blood vessels, you'd see a much more insidious, a much more gradual progression of the disease. Then about 10% of people have said to have a mixed presentation. So they've got multiple different pathologies going on at the same time, and that's usually older people. And about 6% of people have a dementia that's related to either Parkinson's disease or Lewy body dementia. So most people are familiar with the concept of Parkinson's disease as a movement disorder, but may not realise that as Parkinson's disease progresses over time, a significant proportion of those people will go on to develop problems with their memory and thinking. And then at the opposite end of the spectrum, people can develop a similar pattern of problems with their memory and thinking without so many movement disorder symptoms, and we call that Lewy body dementia. We see a particular set of really challenging difficulties in this group of patients because they can experience very, very marked fluctuations in confusion, which might be misinterpreted by people who are caring for them or working with them. They might think that this change from lucid to incredibly confused to lucid again is so marked that perhaps they're putting it on, perhaps this is a behavioural issue. And people can also have huge difficulties processing visual information. So they might experience misperceptions where something quite benign and safe is perceived as something threatening. So the dressing gown on the back of the door is actually a man breaking into the bedroom. Or they can experience frank hallucinations where they have a very vivid experience of seeing things that aren't there. And this can be really troubling, sometimes more troubling for families than it actually is for the patient themselves. Then about 3% of dementias are attributable to other much rarer causes, and I won't talk about them, but there's this last 2%, usually younger people, who experience frontotemporal dementia, which is where there are prominent changes in behaviour and personality and sometimes language, and those changes occur early on and memory problems seem to develop a bit later in the course of the illness. And it's worth bearing in mind that some treatable conditions can also look like dementia. So delirium, which is this acute confused state that people can get into when they've got an infection or when they've had a fall or they've had an operation. Depression is an interesting one. Some people can become so depressed and so anxious that we think they have dementia when they don't. They have an extremely treatable depressive illness and they can return to full functioning. Alcohol misuse, head injury. So this slide shows a CT scan of a brain where someone's fallen and they've got a subdural hematoma, which is an accumulation of blood. There's been a bleed into the space between the brain and the skull. And that's going to cause significant confusion, but that can happen in a very chronic fashion. So people can develop their subdural hematomas over weeks and months, and it can look like dementia. And then we see vitamin deficiencies, thyroid problems, and actually medication side effects. Lots of the medicines that GPs commonly prescribe can cause problems with memory and thinking. And these are the reasons why it's really important to get seen in the memory clinic early on if there's a problem with memory and thinking. But the biggest risk factor for dementia is age. So the older you are, the more likely you are to develop dementia. About 2 in 100 people aged between 65 and 69 have dementia. That number increases to 1 in 5 for people aged between 85 and 89. But just over 5% of people with dementia, so that's around 42,000 people in the UK, actually get diagnosed with dementia under the age of 65. And these are people who are faced with their own very unique set of problems. Because there's such a small number, we're not really geared up as a society to support those younger people who might have a mortgage, might have a job, might have children to care for. We're not really geared up to support those people. That's a real challenge. So dementia usually progresses very gradually, and it may cause problems with memory. So early on, people can forget about recent conversations or events. They might lose or misplace things. They spend half their life looking for their wallet, their phone, their purse, their keys. They forget about appointments or anniversaries, missing the wife's birthday. They may forget to take their medication, or they may forget that they've already taken their medication and take too much medication. And so sometimes we'll go around to someone's house and find the medicines in a complete muddle, and it's very worrying. And they might forget things like the PIN or passwords for internet banking. All of that can get a bit muddled. People also experience difficulties with their thinking. So thinking may become slowed down or muddled. Understanding of things that they previously would have found very easy to grasp becomes difficult, and people may have problems planning and problem solving. So their organisational abilities, their ability to manage daily life becomes impaired. And also their focus and attention, their ability to concentrate and pick out what's important and what's not important in the environment, that can be impaired as well. People can also experience difficulties dealing with numbers, handling money, understanding the value of money. So you can start to think about how all of these problems might impact on daily life and accessing the community. Language. So language difficulties, remembering words and names can be a very early sign of dementia. And there are some subtypes of dementia that particularly affect language very, very early on, and other cognitive abilities are relatively preserved, but people find they can't communicate clearly. And in older adults, of course, language difficulties are often compounded by hearing difficulties. We also see problems with visuospatial skills, so people can experience difficulty recognizing people, things and places, getting to grips with new layouts. So a few years back when the Parkway Centre was built in Newbury, the beautiful new shopping centre, I had a lot of patients who would come and they just couldn't learn to navigate that new layout on the high street, and it caused huge problems for them. People may also misidentify people and things, and I mentioned that earlier with Parkinson's disease dementia and Lewy body dementia. And we can see impaired spatial awareness, so people can appear very clumsy, and they might start falling, they might start breaking things. And they might have difficulty making sense of scenes or images or the written word. And I've already mentioned hallucinations and misperceptions. So moving on to personality and behaviour, this is also affected by dementia. And this little cat, he's meant to illustrate apathy for you. He looks pretty apathetic to me. So people experience changes in their motivation, their spontaneity, the ability to do something, to think of something to do, to initiate a new activity. But also their self-regulation, their ability to process and deal with their emotions and their feelings. So people may perhaps become more tearful or more angry very quickly. So we have changes in relationships because of the way people respond to those sorts of stresses. Perhaps a loss of empathy can occur, which could be very troubling. And we see behavioural changes. So all of these aspects of personality and behaviour can be affected. Dementia can also cause anxiety and depression, hostility, suspiciousness, confabulation, where people can't remember what's happened, so they make up a very plausible sounding story to account for the thing they've experienced. Hallucinations, delusional beliefs, people can become quite paranoid if they can't find something. Perhaps it's because someone's broken in and stolen it. People can become restless and in later stages may wander. And we very, very commonly see problems with sleep disturbance. And in later stages, sometimes we see a little aggression and agitation, and that's often about the fact that there's an unmet need. This is someone who's confused and muddled, and they've got a strong emotional feeling that they need to be somewhere or do something, but they can't express that to the people around them. And so the responses they receive cause them to be more upset and more unsettled, and it sort of spirals. And these are symptoms that can cause enormous distress, both to the person who's living with their dementia and their loved ones. So over time, as these problems progress, the person living with dementia will become increasingly reliant on the people around them to help them to manage their daily activities and their daily needs. And younger people, as I mentioned earlier, who may have dependents, children, financial responsibilities, they may struggle to remain in employment and to meet those financial and family commitments. So the difficulties often progress slowly, but eventually the person living with dementia will need support and supervision in all of their activities of daily living. And if there's no other health condition present, the person with dementia will eventually die from their condition. Now this all feels really bleak, and I wanted to finish my slides on a slightly higher note. So it's not all bad news, because we know about these modifiable risk factors. So there was an important study in the Lancet that's identified 9 modifiable risk factors that mean that we can manage our own risk of developing dementia, but also support our communities to reduce the risk of developing dementia. And these are low educational attainment. So people who don't stay in school for very long or don't have access to education are at increased risk of dementia. Hearing loss, high blood pressure, so taking steps to be healthy and to maintain your blood pressure within recommended limits, midlife obesity, smoking, diabetes, physical inactivity, I like this little sloth, And this last one represents 2 factors, and that's depression, but also social isolation. So we've seen from this study in the Lancet that these are 9 important modifiable risk factors so that we can reduce the risk, we can work on these and reduce the risk of people developing dementia. This is great news. So this is Professor Livingston who produced this study, and she's saying over 1/3 of dementias are theoretically preventable. This is huge. And the factors she identified, those 9 factors, worked on the brain either by changing resiliency, so people were more or less liable to have a problem when the pathology occurred, or they reduced the effects of direct damage to the brain. So overall, she says the message is that acting now in dementia will vastly improve living and dying for people with dementia and their families. There's so much we can do now rather than solely focusing on future care. And we're already reaping the rewards of addressing these risks. So there's a number of emerging studies that are showing that even though the numbers of people with dementia are increasing, the incidence, so the proportion of older people with dementia, is falling. Because we've got an aging population, even if the incidence falls, we're still going to see many, many more people with dementia. But as a proportion, the number's getting smaller. And I think that's because the healthy heart, healthy brain message is getting through and it's working. Okay, so that's what I'm going to leave you with. Healthy heart, healthy brain. Thank you very much.